So when do we recommend the removal of uterus? Well, in cases where a lady is suffering from multiple uterine fibroids and is having pain or excessive vaginal bleeding. It is also recommended in cases where the uterus has descended down into the vagina or maybe out of it, that is uterine prolapse. Hello, I'm Dr. Dhwani Margo, Senior Consultant at SCI International Hospital, New Delhi. And today I'm going to talk about this very important surgery, that is hysterectomy. So what is hysterectomy? Well, it simply means removal of the uterus. It is also done in cases of severe endometriosis or adenomyosis, and also hysterectomy is advised in malignancies or cancers of the uterus or ovaries or even the cervix. It is also done in cases where a lady is suffering from abnormal uterine bleeding. In most of these cases, the lady has already taken her medical treatment which has failed, and now she is proceeding with the surgical management. So there are three types of hysterectomies. First is the supracervical hysterectomy, in which only the upper part of the uterus is removed and the cervix is left behind. The second is the total hysterectomy, in which the complete uterus is removed along with the cervix. And the third is a radical hysterectomy, which is mostly done in malignancies, in which the whole of the uterus along with the cervix and the side tissues which are attached to the uterus are also removed. So there are, in certain cases of malignancies, along with the uterus, we also remove the tubes on both the sides and the ovaries. So it is then termed as total laparoscopic hysterectomy with bilateral salpingo-oophorectomy. So what are the techniques to do this hysterectomy? So there are different techniques to do this hysterectomy. The first technique is the traditional one, that is the abdominal hysterectomy, in which a 5 to 7 inch incision is made on the abdomen, which can be a transverse incision or a longitudinal incision, and the uterus is removed through that incision. The second technique is the vaginal hysterectomy, in which the uterus is delivered through the vagina and the stitches come on the vaginal walls. And the third technique, that is the total laparoscopic hysterectomy, that we are using most commonly now and is most recommended. In that, there are very small incisions, about 1 centimeter in size, made on the abdominal wall, and the uterus is delivered through the vagina. So what are the benefits of total laparoscopic hysterectomy? Well, compared to an abdominal hysterectomy, there is a faster recovery, decreased stay in the hospital, the patient has less blood loss, there are less chances of infection, and even less chances of incisional hernia, and also less scarring. So there are certain complications which are involved with this procedure, like urinary incontinence or walled prolapse or a vaginal fistula, and all of these are treatable. So what to expect in the recovery period? Well, it takes about 6 weeks for complete recovery, and if only your uterus is removed and the ovaries are left behind, then the lady will have menopause after 3 to 4 years of the surgery. In case both the ovaries are removed along with the uterus, the lady will go into menopause immediately. So I hope this video has been helpful. Thank you.